how do you leverage yourself as a new grad or someone a few years out of school where you can negotiate that, okay, I want 35% of adjusted production, or I want 45% because I know I'm going to bring you a whole bunch of money because I can do molar endo confidently,
Yep.
or I can do surgical extractions confidently. I know some people, their schools harp on documenting your cases, doing case presentations, etc. As someone that's just graduated, I got that degree in hand, I'm ready to work. What do I do? Good money coming out of school.
That's a great question, Eli. The first thing you need to understand when you just graduate is you don't have the leverage. You have to earn it because you haven't produced anything, right? What can you do to leverage or get the most? It's gonna be the same, like I hate to keep using sports reference, but it's like when they do the NBA draft, it's like, okay, they're gonna look at what type of person were you in dental school, but really what they're gonna be looking at is how do you present yourself? Your resume is all cool, you got a 4.0 in, anatomy. They're not gonna care about that because now, like I said, you're in the people business.
Yeah.
So the best thing I can say to you is when you're coming out, there's gonna be a range of things they're gonna offer. You can expect as a general dentist, 500 to 800 daily guaranteed minimum. Depending on where you're at, that's different. Sometimes that's only for 6 months, and then you strictly paid on a percentage of collections or a percentage of adjusted production. So those of you that don't know, collection is how much money they actually collected from the procedure and when insurance pays, and insurance don't always pay the same day. And production is basically the value of that treatment. So if I do a crown for $1,000, the insurance only paid 500, I'm only gonna get a percentage of the 500. Adjusted production would be close to the $1,000. In private practice settings or smaller DSOs, you're gonna have a daily minimum just because, it's gonna take you 6 months to build the following. What you can do is present yourself well. I've actually worked with some clients in my community, just like how to properly interview, what things to say, let them know your goals. Like if you're already able to say, hey, I'm a general dentist, I just graduated, I'm really passionate about, case acceptance and building rapport with my patients. I have a goal that I wanna, in 1 year I wanna be making $100,000 per month, and asking them, what can you do to set me up to do that? Do you have the patient population for that? How many new patients? So basically you are not just getting interviewed, but interviewing them. And when you're able to present well, they're gonna give you the most they can before you actually get on the books and can start showing your numbers. It's like you have to get out there on the court and put up the stats on your stat sheet. Then it's like, all right, cool, like your rookie year was crazy. We want to give you the $50 million contract now. By presenting well, by showing that you know what you're talking about, they will give you the maximum. When I left my first job to my second DSO, the range for a daily minimum was like 500 to like 800, right? They were telling me like that, like when they were basically giving me the interview, and it was like 30 to 33%. That's also standard for smaller DSOs and private practice. You can expect 30 to 35%. Something like an Aspen is different because they do like a profit share system. So the way the profit share system works is you always will get a daily minimum, regardless if you produced enough to like earn that or not. But whatever you produce past your daily minimum, you'll get a percentage of what the office profited as a whole, not just what you made. So it's usually a smaller percentage than that 30 to 32% that I told you. The idea is that they're encouraging you to not just be successful yourself, but make your hygienist busy, make your surgeon busy. The idea is to make everyone contribute to the collections and production. Then you get a check for a bonus for that month. For the most part, standard, smaller DSO, private practice, you're looking at anywhere from 30 to 35% of either collections or production. Don't go out there thinking you're gonna get production right away. That's not really out there. If they do, sometimes they sell you adjusted production, which ends up being close to collections. So that's something you want to ask about too. What is the collections rate that you guys have? To answer your question, I went off on a tangent, but yeah, you want to present well. You want to know what you're talking about, and having already, this insight that I'm giving you guys on this call, you're going to go into that interview because they're interviewing a bunch of new grads, right? So it's not like you're the only one. So what they're saying is like, okay, wow, this guy or girl, they seem like they can be a leader. Like I would be their patient. They're humble too. And that's something I think, I've had a new associate that we had worked with, and she really came in like super cocky that she knew everything. I was literally giving her a red carpet. We're here to train you. I have older docs that are willing to help. And she's like, oh no, I don't need that. Why are they making me do these mentor calls? And you know, she would do like molar endo and perf a tooth and then be like, oh, I'm gonna have them come back. And I'm just like, what? You know what I'm saying? It's so, you wanna be humble. You wanna say, look, I just got out of dental school. I can do these procedures. I wanna learn, okay? If you guys can invest and give me the tools and resources, I wanna learn how to do molar endo. I wanna eventually place implants.
I think there's value in knowing what you know and what you don't know. Everyone wants to present with some degree of confidence. It's important to be confident as a dentist in what you can do and what you bring to an office. But you do have to understand that 10 times out of 10 as a new grad, whoever you're interviewing with, they've been in your shoes, they know how it goes, they've seen it happen time and time again. And I think another thing that you mentioned is super important, because this is the advice that I give to pre-dents all the time. When you're going into an office to be interviewed, that's your chance to feel out the office too.
Exactly. So I hope all this helps. If you have any further questions, you can hit the link in my bio. Join my private school community, which is 100% free. Ask me any questions. I'll do my best to guide you. I'll give you a link to that service I told you about. And like, comment, subscribe, and I will see you guys in the next one. Peace.